when I went in, the doctor told me I had a 50-50 chance of living.
So come on and check yourself before you wreck yourself.
Hi everyone. So I want to say welcome to the Dr. Grace Experience. And today I have my fabulous patient, Stephanie.
Hello.
I'd like Stephanie to share her story of her journey here. So Stephanie, what brought you into this office?
Well, first it was an Instagram post. I was praying for help with my TMJ, my anxiety, my migraines, and it just so happened that as I was scrolling, your picture with the, hey, are you suffering from ABC? And I was like, yeah, I'm suffering from all of those. So I clicked on that sponsor, and within a matter of minutes, I got a call, booked my first consultation, and a year later, I'm still here.
That's wonderful. So tell the audience, besides the TMJ and the anxiety, like how was your life being affected by what was going on with you?
Okay, so in 2018, I was diagnosed with viral meningitis, which there isn't any antibiotics that they could give me. When I went in, the doctor told me I had a 50-50 chance of living.
Wow.
Yes, it was very intense. And at the time, my daughter was only 5 and I was 27 years old. So to hear that at such a young age, it was very catastrophic and very scary. After the 3 months in the hospital, my whole body just kind of changed in a negative way. I had lockup from the meningitis all on the right side. I couldn't even stretch out my arm without it shaking from the nerves being bundled in, and it just affected my whole jaw. I was talking like just so tight, like when you met me.
Yes.
Luckily, the masks were on at the time, so no one could see how much pain I really was in. And from that beginning to where I am now has just been a complete life change.
So when you say life change, like what's improved for you? Like what has gotten better for you?
How much time do we have? So complete, from physical to emotional to cognitive, just all around better. So when I was in this fog of pain every single day, and I got tired of saying I hurt or this hurts or this, and I could see it in my loved ones that they were tired of hearing me complain. And my emotional state was going into a state of depression.
Wow.
Because I wasn't getting anything good in life anymore. Everything hurt. My the way I viewed things were negative all the time, because in here was just negative. And after your care, I slowly kind of started seeing changes at the beginning, but as the months improved, my posture improved, my range of motion and smiling started improving. My daughter was even like, oh mom, you're taking bigger bites while eating. And I was like, yeah, I could do that now.
Right. I want you to share with the audience the process that you went through here from the beginning portions of your first day, the exam, the consult, and then we'll go into that.
Yeah, for what I can remember, the first day, I was very just open-minded to anything. I was already seeing a chiropractor before. Through my insurance, I was doing acupuncture, different physical therapies, and nothing was alleviating my main concerns and issues. Yes, thank you. So when I first came here and it was a consultation, it was very like, oh, what do I do? And then there's like, I was used to just going in, getting adjusted, and then leaving. But there's just so many amazing steps that were given to me, like the correction care and the stretching and the movement, and then the x-rays to show scientifically this is what's been wrong with you. This pinpoints all the things that I was questioning that no one was giving me direct answers to.
Right. So to share with the audience, when you first come in as a brand new patient, I sit down with you and do a very thorough consultation and history taking. It's important for me to understand as your doctor where your health has been, what struggles you've been through, what trauma history you've been through, so I can really understand what your body is needing today.
Today is all about you.
So understanding all of that, and then that gives me enough data to do a very comprehensive exam. So the exam process is different than most chiropractic offices. We do a global pattern x-ray testing. So for instance, if you have lower back pain, most offices don't take x-rays, or they may just take a spot shot of your lower back. In my office, we do literally from neck, middle back to lower back. Why is that? Your body is a kinetic chain. Mm-hmm. You may be having lower back pain today, but it could be offset because your curve in the neck is pulling you forward, straining that lower back. So I can adjust you till the cows come home for the lower back. If we don't address the neck issue, it's not going to stabilize your issue and you won't have resolution of your issue. So let's talk about now your treatment process, right?
Yes.
Were you given an exact plan of how to correct and stabilize?
Oh, yeah. I believed everything you said because how you said it, and you looked directly at me like, this is what you need to get better. And my heart told me, listen. And I am so thankful that I did.
Just to elaborate on that, when I actually put together a treatment plan, and if you're hearing snoring right now, it's because my little first son is taking a nap in a nearby area. So can we just pan over to him real quick? So that is my 12-year-old beloved fur child, Atlas. You'll see him if you happen to come into the office. So back to the plan of action for you. It's data-driven. Nothing is by guess. Nothing is by, well, I think this would maybe you need. It's all specified based on your exam results so that we have an exact roadmap to get you from point A to point B. Mm-hmm. Now, let's talk about the adjustments.
Oh my gosh, that's my favorite part. What I like about the first thing I come in here is do the corrective care, so that warms me up.
Right, so she's talking about the active therapeutic exercises to get your deepest spine muscles that have been hardened and tightened and calcified over time to start freeing up and loosening and warming up.
Mm-hmm. And once I get to that state and get to come into the room, oh, I'm ready. And the first couple adjustments, my body was so stiff. It was almost like it didn't want you to make the adjustments. It was like almost fighting against you.
Right. So you're put into a very specific positioning so that you just need a gentle nudge to get the system into alignment again.
Yes.
So there's no forcing. It's very, very gentle, and it's very freeing, and it's stabilizing. Because it's done vector specific, meaning when I get your x-rays, I get to see exactly where your spine is curving the wrong way, where it's actually too straight when it should have a nice arc in the lateral film. So there's many factors that go into how you get adjusted so that it's customized to your spinal needs. So shall we show the audience how we take care of you?
Yes.
Okay, so I'm going to check Stephanie's jaw and the range of motion of her jaw and see if there's evenness or any fixations. Ready, Steph?
Mm-hmm.
Okay. All right, so slowly open the jaw. Okay, so her jaw pulls to the left right now. So I'm going to use my instrument. This is called a MDT. And I'm going to adjust accordingly to the range it's fixated in. And the opposing direction for the other side. Very gentle, not abrupt, and not too strong. Okay, open slow. Perfect. It glides instead of pulling. So we gently adjusted, put back into harmony the hinge range of motion in her jaw. So now I'm going to check your cranials, because the cranial plates, your skull bones, actually can move. And internally, where the flat plates are of the skull is where the brain attaches, especially in the temple region. So I'm actually, is that a little tender? Yeah, so I'm just gently repositioning the suture line right now. Good. Excellent. Now I'm going to move on to checking Stephanie's upper spine, which is her cervical spine, her neck region. Ready? All right. Okay, relax for me. Ooh, you feel that guy, right? Yeah, so she has a misalignment, also known as a subluxation of her first rib and her C7. So I'm going to adjust that. When you have that region out of alignment, that can cause a lot of upper back pain, maybe sometimes arm pain. And believe it or not, C7 goes to your thyroid along with T1, so that can affect glandular function. Okay. Very good. Yes. Good. So we have another misalignment, subluxation on the opposing side. You ready? All right, love. Beautiful. So I do check thoroughly every level to make sure all the vertebrae are aligned properly. It's very specific. Okay, good. Now, I'd like to check Stephanie, mid-back, lower back. And let's have you turn over, please. Okay. So, I'm checking Stephanie's leg length. Why is that important? Well, if your leg length is short on one side and long on the other side, when you're standing upright, you're not going to be like really leaning over, but you might have a slight tilt going on. And if you think about it, if you walk like that and stand like that and bend like that, that can cause a lot of spinal issues accumulated over time. So I'm going to check Stephanie's hip motion. Okay, relax everything, Steffi. There we go, love. I'm putting equal pressure on both ankles. Her left leg is way further back than her right leg. There's a rotation in the pelvis. So I'm going to use a drop adjustment to clear that out. Very good. So what I just did was a high velocity, low force adjustment. The table moves for us and my hands glide that joint to release. Good. Yay. Hercules, happy feet. Good. That balanced her out. Now I'm going to check her mid-spine. All right, Stephanie. So now what I'm doing is palpation, meaning I'm going to feel for every single joint's mobility pattern. So her upper back has a slight tendency to pull to the lateral side. Let's have your arm pull back. And I'm going to adjust opposingly to get it centered again. Beautiful, Steffi. Good. Okay, so now I'm going to adjust her lumbar spine, her lower back, to clear out the lowered. All right, let's go right side down. All right, let's bring your head up. Thank you. So I'm going to feel for each level, and I found the area I'm going to adjust. Beautiful. Let's go tummy down. Good, legs are cleared. Okay, so that's where we end off with the spine. I know some of you who have gone to other chiropractors are used to one side and then the other side. I check my patients after each adjustment before I go to the other side. In Stephanie's case today, she neutralized and balanced out, so I will not be doing the other lumbar side because I'll be putting her out of balance again if I did that. Stephanie.
Yeah.
You ready to sit on up?
I am.
Okay, come on up. All right, so how do you feel?
Oh my gosh, let me come back too. I love that my body is so responsive to your hand. So when you go to adjust, it's like it already knows what it needs to do. And that's what I love. It's every time it's like, oh, I can breathe. Oh my goodness. And I laughed because when you were adjusting, I knew my rib was out. She teaches well. You are very good at explaining each time you're adjusting. And because of the repetition, I'm learning as well. Yeah. And so I could kind of understand where my body's rotating. And so I kind of, when I come in, I'm like, oh, she's going to tell me my ribs are out. Yep. She's going to tell me I'm rotated. And it's great because not only am I getting the knowledge of my own personal body, I'm also experiencing what I could prep my body for to not go further out into like the extreme of like my jaw, my back, and feeling pain or hurting myself.
Right. So it's important for me to be able to educate each client on how the body functions and what they can do at home to prevent further misalignments from happening and to be able to hold their adjustments longer. It's all about stability. So I want to really thank you for sharing your experience and sharing today's experience with the audience. Yes. And I hope you guys join us for the next one.
So come on and jiggity-jack yourself before you wreck yourself.
Okay, so I wanted to have a conversation with y'all about the subject of breathing. and how important it is to be able to breathe the right way to have the most out of your day. So you just saw a video or an interview with Stephanie, and she had a horrific experience with viral meningitis. And from that, she had a lot of stress and tension and anxiety. So I know that most people nowadays don't have the viral meningitis, but I do know that a lot of you do have a lot of stress and tension going on. So I wanted to show you a very simple way to reduce stress physically so that you can relax and have a better day. So I want you to sit up with me. Everybody sit up, and I'm going to teach you the art of somatoreflex breathing. What is that exactly? It's deep breathing technique that's going to help reduce physical tension and help your adrenals release happy hormones, as well as help your nervous system regulate better, meaning it's going to process information and your mood at an easier state. Okay, so sit up with me, and what you're going to do is breathe in for 5, hold for 5, exhale for 5. But a little trick: when you're breathing in for 5, I want you to inhale through your nose, inflate your lungs and your belly. And while you're doing that, visualize your favorite meal. I'm a foodie, so I think of food, but if that's not your jam, I want you to visualize something very aromatic like plumeria, or if you don't like that, whatever else smells good to you, okay? Then you're gonna hold for 5 seconds, and then you're gonna exhale for 5 with power exhale. What that means is your lips have to pucker like this when you exhale instead of like this. You won't get as much release if you don't pucker your lips. Okie dokie? So we're gonna breathe together. We're gonna do 5 reps together. Here we go. So breathe in through your nose. Hold. Exhale. Good. Let's do it again. Breathe in through your nose. Hold. Exhale. That's 2. We got 3 more. Let's go. Breathe in. Hold. Exhale. Almost forgot. All right, 2 more. Here we go. Breathe in. Hold. Exhale. Lastly, breathe in. Hold. Exhale. Good. So we did just 5 sets of those. 1 set is in for 5, hold for 5, out for 5. Typically, I recommend for stress reduction at least 10 sets, okay?
You got it, dude.
If you can pull out 20 sets, fabulous. If you do that on a routine basis, like every hour, every other hour, you could do it while you're at work, while you are driving, while you are just sitting, watching TV. Breath is life, oxygen is free. So I want you to use plenty of it to help yourself relax and have a better day.